Season 2 of the Strange, Rare, and Peculiar podcast, a place to learn more about homeopathy, deepening your knowledge, expanding your universe of possibility in the world of health and well-being through homeopathy.
Homeo what?
Homeo what?
Good morning.
Hello.
Hello.
Hey.
Good evening. And good afternoon.
And all of that. Welcome to...
And everything in between.
Welcome to Strange, Rare, and Peculiar post-influenza
It is...
edition.
I believe it's been a week.
We skipped a week.
We skipped a week. Apology, folks.
We were too sick.
Apologies. But we succumbed.
We did, didn't we? Went down hard.
You went down like a bag of potatoes.
I burned a high fever. It was on Easter Sunday. We had friends over. We had a wonderful day and dinner.
Yeah.
Everybody left. I think the door closed, and my temperature hit about 103.
And you had the sweatiest night imaginable.
I thought I scorched the sheets.
Yeah.
I was proud of myself for throwing a high fever.
Yeah, and then I was sort of looking after you, attending to you beautifully, wasn't I?
You totally were. Yes, you were indeed.
Like those sticks of butter and the pate.
Yeah, so let's just start with the first time that Al ever attended to me when I was sick, I think would have been in 2015. And
I really made a name for myself.
really did. So I felt I had a little GI thing happening. I felt really sick to my stomach, and I came home from a teaching day, and I got in the bed, and Alastair lovingly brought me a tray. And on that tray was pate.
Yes.
Some sliced onion, some Cornichon pickles, some bread, and I think this is the part that really got me. Like, as if pate for an upset stomach might not have been a poor choice, it was the half stick of butter in a little bowl. What could you possibly have been thinking, honestly?
Well, I was thinking about me, I think.
Right. Oh, and I think there was cheese. I think there was a block of blue cheese gorgonzola or something. Oh my goodness!
I have to formally apologise for that. I mean, it is almost 10 years ago. I was doing my best.
You really were.
But and then, so you were doing all right for a day or two as you went deep, and then unfortunately I succumbed.
You got sick 2 days later,
and then suddenly I had man flu.
Oh dear, yeah.
And then there was
the moaning, the sounds that accompany man flu. And so what we thought we would talk about, we thought we would do this last week, except we were actually too sick to talk about it, which is really interesting because if you're a homeopath, number one, people think you shouldn't get sick. Number two, they think your children and your pets also should never get sick. I can remember people looking at me when I would say that one of my kids was homesick, like, you didn't fix it, right? But homeopaths get sick.
It's interesting because during our sickness, when we were looking at each other pathetically and plaintively, we actually worked out that the previous time we were sick like this was 25 years ago.
25 years ago. We were both sick at the same time.
Yeah. Well, for me, September 2020.
For me, it was January. Wait, not 2020.
Yeah, it was.
Oh, for me, it was January. It was 2000.
Oh, I'd said 2020. I'm sorry. I meant 2000.
Yeah.
I'm going, the Sydney Olympics.
Right. 2000. It was, for me, it was, January. Yeah, January, February, something like that. Anyway, and we were talking about how getting really sick often can be, when you get sick to the point where, like, everything must stop, it generally is a signal that you need some change or something has to happen.
Well, you've got to stop.
You have to stop. Also, and I think this is that I was really interested to talk about, though, was just this is kind of the intersection of a number of topics. I was teaching in part-time year one, the folks that just started in January, acute foundations of acute prescribing.
Yeah, I heard you talk about that on Monday.
Yeah. Was it Monday?
Wednesday. Sorry,
yeah, on Wednesday night. And it was, and part of the conversation, there's sort of this long intro to the conversation, intro to acute prescribing, that is about the difference between something acute and something chronic.
Yeah.
And the decision-making process that goes into a homeopath's choice of whether or not to treat something. And I think, on the tail end of some of the things that we've been talking about, sort of the culture of overprescribing that has taken over, like Beatlemania in America, this conversation about restraint carries a lot more weight, doesn't it?
What do you mean about not prescribing? In other words, are you saying that there are times to just let there be sickness?
Yeah.
Let there be sickness.
Let there be sick. And then there are times when you shouldn't at all. And there are all these different considerations that go into it. And one of them is sort of where a person is along the trajectory of their chronic journey, right? So there are some cases where I definitely wouldn't intervene. And what I was saying to the students was, in cases of complex neurological autoimmunity, it's really difficult to, if you've got a person moving in a really good direction, sometimes to intervene with an acute remedy can send that case off the rails a little bit. And part of that is kind of requires the discussion of what a homeopathic remedy does or doesn't do.
Yeah, very interesting.
Right? But the other thing is something truly acute. And that's actually where the action lies, I think, in a generalized conversation.
But you and I were totally down with acute illness.
This was 100% acute. Of course, we weren't sure when I was the first one to get sick. Then when you got sick, I realized, this is
because
totally...
of your hypochondriacal tendencies. Is that what you mean?
I mean, well, there's that. But there's always that. I mean, that's why I picked my job. It satisfies my hypochondria, my pathology at every turn. It's genius.
Yeah.
And my nosiness. It's all the things that I need in my life all rolled into one.
All of the things.
But when you got sick, then it became apparent because you had exactly the same sickness and progression of symptoms. And then one of our friends who was with us on Easter, she got sick, same day you did, later in the day. And then her husband got sick the following day.
Yeah.
And so four of the six of us wound up getting sick. Interestingly, the 20-somethings didn't get sick.
I blame them.
Do you? I'm still searching for who did this to me.
That's hilarious.
And when I find them, maybe I'll thank them, actually.
But it's interesting, isn't it? Because, I mean, when I think about what, if I just sort of sum up what you just said over the last 5 minutes or so, I too would have been thinking, okay, so I'm going to study homeopathy. Homeopathy is the panacea. Homeopathy is the thing which is going to keep me and my loved ones, my animals and everything healthy. And then what you're saying is, no, actually there's a challenge to that, because firstly there are times to just allow yourself to get sick and leave well alone and just sleep. Yep. And then in the instance that, I would say you and I attended to each other pretty well, and we really did not nail prescriptions quickly based on the symptoms that we had. It was so weird because we had very muddy symptoms. Yeah. You kept saying to me in the beginning, tell me, I need characteristic symptoms. And I had, actually, let's go back to the very beginning, because I think, I was so sick in the night, and I hadn't really told you how sick I was, because once I got a dose of aconite, it helped immeasurably. And I think you did better because I took aconite as soon as I felt
the minute. We say about aconite, by the time you take it, it's often too late. Yeah. And I would have been, let's see, if I would have fallen ill at, let's say, 9 p.m., I knew I was sick. I don't think I took aconite for 12 hours, maybe 10 hours. Right. Yep. And as soon as I did, there was a shift.
So aconite was useful, but what it does is it doesn't make it go away. It moves. The way I perceive it, and especially in my own when I'm ill, I perceive that I'm moving through phases, or necessary phases, fairly quickly, and then symptoms change, and then they stop. Right. And then I'm probably pathetically saying to you,
well, I think because you started by saying that we didn't really nail it with remedies, and I would actually disagree. I would say that there was the waiting period until symptoms gave us what we needed, and I think that the restraint in prescribing probably helped us, because one of the challenges is you take too many symptoms, it muddies the water, and then you don't have characteristic symptoms because you've chased the tail of the dog around too much.
Oh, that's so interesting. So for me, do you remember, because I forget, But I had an excruciating symptom that was just really distressing, and it was as if there was sandpaper or on my forehead.
Right.
Did you know I got in trouble with students the other day? I had a little tantrum. I haven't told you this.
Oh, dear. Do I want to know? And do you need to share it publicly?
Well, I think it might have been one of those first full-time students that was saying, "What's he saying?" And I could see her saying that out loud and then writing to other people in the class. And the word I was using was forehead.
Oh, forehead.
And then that's exactly,
yeah.
Are you saying forehead? And I said, yeah, except the word is forehead.
It's really not. It's forehead.
No.
It's your forehead, not for the number. It's the front. It's the part of your head in the fore.
But the pronunciation is forehead.
Well, you can pronounce it like that.
Well, exactly, and I will continue to do so. Anyway, this distressing symptom of mine was in the forehead. And it felt as if I needed desperately to cover it, but I couldn't stand any covering on it because of the nerve sensitivity. And it was sort of like this feverish feeling. Oh, my
It was the worst. And there's really, and you start going through and repertorizing and looking in the repertory as if this oracle is going to give you an answer.
No, that's the reason why I mentioned it, is because what's really just pulled me out of this, and now I just got the remnants of the cough, was by leaving that symptom alone.
Yeah.
Because the remedy which has pushed me through was not in that rubric.
That's right.
Yeah.
And that was something, and that's something that actually we were talking about.
I'm sorry, one more thing. It's because I've had that before.
You had it before. You had it after COVID.
Yeah.
It came on after the first time you had COVID.
Yeah.
And that's when I said it's part of the chronic. And so let's go back rather than just reminiscing about our sickness, right?
Oh.
Because I think...
I thought that was the whole point of today.
Excuse me. So what I was thinking about, though, is I think sometimes personal experience allows you to explain things in a really clear way that sometimes is better than examples that you're using from far in the past or maybe that aren't your own, right? And so I was thinking about this just especially because with some of the cohorts, we're at points in the curriculum where they're having to make these choices about the totality of symptoms that needs to be included in the prescription.
Yes.
And like you just said, when there are times when leaving a particular symptom out is appropriate, because sometimes you've got a symptom that is a part of the acute, in other words, the constricted totality, or a symptom that I should say sits outside of that acute or constricted totality. And if you put that into the mix, you're muddying the water because...
It becomes a red herring, 2 hours.
Or it becomes a sardine in the smoothie, which could
Correct.
be maybe a herring in the smoothie. Anyway, so this idea...
inside of baseball, that is.
Yeah, it sure is. So the biggest criteria in deciding whether or not it's appropriate to give a remedy is, do you need to give a remedy? Now, I know that doesn't really answer a question. It's like, no, duh, Denise. But the definition of an acute is you either get over it or you don't. In other words, an acute is by its nature a self-limiting condition, right? Or something that without intervention will claim the life of the organism. And I think that it's important to understand that definition as a homeopath, as a homeopathic definition, because when Hahnemann gives us that information, which is like in aphorism 72, I think, it's in the 72, 73, 74 suite, where he starts to introduce the concept of chronic miasmatic disease. And so as of around 1816, that's when Hahnemann first recognized that not all diseases are the same. In other words, not all befallments to an organism need to be understood in the same way. There are both acute and there are chronic, problems that human beings face. When you're looking at something chronic, I find it just so much easier to understand concepts when I think of them through what's Hahnemann trying to tell us, right? So he says there are both acute and chronic issues. If something is chronic, it is if it's part of a dynamic disease, that means that it's arising from the individual themselves from a deep miasmatic sort of taint on the organism.
Cause, yep.
Yeah.
Yep.
And so there are underlying chronic diseases. Now, of course, that language is really problematic to a non-homeopath, because to a non-homeopath, chronic disease means something totally different, right? To an allopathic person, a chronic disease, the term chronic is defined by its longevity. How long has a person experienced a symptom? So a chronic cough is a cough that lasts X number of days or weeks, right? A chronic backache exists for a certain period of time. Hahnemann is looking at it through, it's a completely different set of criteria.
Totally.
Yeah. But I don't know that is always made clear, especially in sort of the more pedestrian conversations about homeopathy, right? So I think if we're going to talk about, acute versus chronic issues, the first thing is it actually acute, or is it a part of the evolution of someone's sort of deeper chronic condition? Now, just because someone has been identified as having a deeper chronic issue, it doesn't mean that they're necessarily sicker. It just means that we can understand that what's happening to them is related to a pattern, a slow-moving pattern, as opposed to the rapidity of an acute expression of disease, right? Do you think that's clear?
I think if you want an analogy, you would look at the ocean.
Yeah.
And what you see are the crests on the top of the waves, the foam. Mm-hmm. Yeah, but there are currents and movements underneath that are still... Like that. Yeah, thank you. And so it's still water, it's still the sea, it's still health.
Right.
But we're not interested, if we're dealing with acutes, with anything which is below the surface of the water.
Oh, I like that.
Yeah.
And so I think once you get into this really, like this clarity of the definition, acute and chronic presentations, it also requires us to remove the whole person is sick, right? That it's like sort of another misnomer that goes into the puzzle, into the pie.
Oh, I see. Because we often do end up, and the reality of the situation is that we get sick, and we get completely sick.
We get completely sick, and Hahnemann says...
all the different parts of us.
Exactly.
Not just physical.
Right. Yeah. So the whole person idea, though...
But we are not taking that into account necessarily in a specific clinical situation.
And we don't take into account the healthy parts of the organism.
Right.
Even if we're looking at their chronic case. This is why people who are looking at sort of the personality, it's very different, because what we're looking at is... we actually are prescribing on the sickness. We're not prescribing on the named condition, but we're prescribing on the sickness or the unintegrated totality. We're prescribing on the part that sits outside of the healthy organism. Well, that's sort of a bad analogy because it permeates the entire organism, but it's not integrated toward health. Yeah.
Sweet. Makes perfect sense to me.
Yeah.
I love it. Yeah.
Okay. So a person gets sick, and we have to determine, is it acute or is it chronic? And an acute generally has an exciting cause. Something happens that results in sickness. It could be you get too close to something hot, or you touch some fire and you have a burn. So the exciting cause, something that is causative, it could be a germ or a bacteria. It could be a cold wind, right? It could be eating bad potato salad at a hot picnic. Ew.
Or a Jello salad.
Jello salad. Anyway, all of those things are causative. And then what happens is there's a causation, and then there's a response.
And the response is quick.
The response is quick.
It comes quick.
Yep.
It goes quick.
Yeah. Well,
the symptoms are intense.
Should be, yeah.
And?
Usually accompanied by a febrile response, a discharge, or an inflammation. Right? So determining if something is acute is basically, did something cause it? Right? And the reason Hahnemann is asking this, because if it just arose from the person, so like when we're talking about me getting sick on Easter Sunday, right? It could have just been that I worked myself into getting sick, wore myself down, and my chronic stuff started to show itself. Entirely possible, right? Given my misbehavior. But when you got sick, it was like, oh no, there was an exciting cause. There was a virus, whatever. right?
Yeah.
So that changes things, because if you're looking at someone who sort of falls ill and it's a part of their chronic case, you're asking a different set of questions than the acute, right? Now, sometimes people say, can you use the constitutional remedy to treat an acute? That brings up all sorts of issues.
I don't even know where to begin with.
Let's start with constitution.
Well, the constitution is a thing.
It sure is.
It's one of the more poorly understood terms in homeopathy for various reasons. So constitution, I have no problem with. Hahnemann talked about constitution.
Totally. We all have one.
Yeah, and, it's that which is unchanging. The eye colour and the shape of the face and the, the quality of the teeth and all of those things, which generally come
the
down
body
the
type.
line.
Are you phlegmatic? Are you melancholic? Your temperament is a part of your constitution.
I say you, sir, are a sanguine character. Yeah. So that's what is meant and truly meant by constitution in homeopathy. Unfortunately, into homeopathy beginning around 1880, 1890, and then really being picked up by the Brits, actually, and British medical physicians, and then their influence, we started to hear about this term called constitutional remedy.
Yeah.
And
but it was being used here in America, but the term came from the beginning of the insurance, the beginning of health insurance, because having identifying someone's constitutional type was being used to calculate actuarial data. In other words, if a person has what we would now say is a high BMI, right? So someone who is prone to obesity would then have a greater propensity toward cardiovascular disease, and they might have a life expectancy shorter than their trimmer.
Not such a great insurance,
Exactly.
Bet.
And so the idea of the Constitution became a part of the conversation at the same time that homeopathy became a part of the medical conversation.
Well, yeah, but for clarity, the idea of constitution in the Western tradition goes back to Hippocrates.
Oh, totally.
Yeah. Oh.
But I'm saying it became a part of like the medical conversation.
Got it.
Yeah.
So into homeopathy, we start to then get a slightly different type of case taking.
Yeah.
And a slightly different type of analysis, and language around that, and so. One of the most obvious examples would have been the physician to the Queen, Marjorie Blackie.
Yeah.
So I think I forget who was before Sir John Weir, but he passed on the baton to Marjorie Blackie, who then talked. She wrote the book. The patient, not the disease, and. Very often, and then on this side of the Atlantic as well, it was Elizabeth Wright Hubbard, who of course did her prescribing, driving around in a very, very
big
fancy
car, right?
Rolls Royce.
Yeah.
Oh my God, in Boston, eating bologna sandwiches.
Wait, I never heard about the bologna sandwiches.
Yeah, she always had a bologna sandwich in a desk drawer.
Ew.
No, because she might need to keep working through lunch.
But of all the choices.
Well,
Anyway.
Let's
proceed.
Let's not tarry on this point.
Tarry not.
Because we started in those books, we started to see this idea or hear the idea of the constitutional prescription, which in fact, when you scratch the surface, only ever meant if you've got a healthy person in front of you and they need a tune-up, give them the remedy, the broadest, usually, well, it's always a polycrest.
Yeah.
That they always respond to. And when you think about it today, that does not translate beautifully into modern prescribing. Because number one, I don't think we have that many healthy folks.
Right.
And two, it takes an awful lot of time to sometimes find that remedy, which an individual seems to respond to on a regular basis.
But it's also, I mean, I want to be careful with how we say this, because there's, you see this on Facebook. I had to stop looking at these Facebook groups because it gets my blood pressure up. But, when people inevitably will post, how long should it take your homeopath to find your constitutional remedy? Yeah. Anyone who's got
it's a poor question.
It is. It's a very, we've set people up to ask that question. But the thing is that it might be never, because it might be that your homeopath needs to be working on the totality of symptoms representative of the chronic larger totality.
Yes, the train wreck that is your health needs to be attended to, and that could be years and years of chronic treatment before you even ever get to a state of health as an adult, whereby you pump out a cold every year, and you respond to this remedy.
Yeah, but even still, we have remedies that have that have acute corollaries to them. I mean, sorry everybody having to listen to us hacking up a lung over here, but think about the relationship between Calcarea carbonicum and belladonna. Right. Belladonna is often the acute to Calcarea's chronic. So that simple example sort of precludes that idea from being fully, there. And, is your quote unquote constitutional remedy going to, do the arnica job or the symphytum job or the apis job,
It's really interesting, isn't it? Because when you even talk to prescribers, I'm serious actually, a lot of British medical prescribers do still speak about constitutional prescribing. But when you talk to them about it, they're limited to about 12 remedies. That's what they do. Right.
I suppose you could probably get some movement unless a person is really sick. I mean, I think maybe that's really the criteria, isn't it? That the likelihood that a quote unquote constitutional remedy, sort of this, a bland polycrest prescription, its success would be dependent on the vital force of the client, because a healthy enough individual might be able to extract from one of these large, these polycrest remedies, a polycrest remedy being a remedy that has action on many, many, many fronts, right? Like a Calcarea carbonicum, for example. Then a person might get some traction from it, but you get a person with an autoimmune issue who has a neurodegenerative condition, or somebody who has Crohn's disease, or, Cushing's, or whatever the case may be. You need to find a remedy that actually fits that case. And sometimes the remedy might be a remedy that doesn't have a ton of information about it, and we wind up having to do a deep dive into materia medica to find that which fits the state of the client.
So what you and I are agreeing upon is that the term constitution, while it might be useful to describe features of a person, the use of that term in homeopathy, especially in relationship to a remedy, is very unhelpful. Yeah. And we much prefer a simple description of acute prescribing or chronic prescribing.
Exactly. So if something is truly acute, it needs to be prescribed for, right? So a lot of times people say, sometimes the students get nervous. Should we give a remedy for that? Well, if it's a true acute, then there's a higher than likely possibility. That higher than likely?
Higher than likely possibility.
Is that, what I mean? There's a highly likely. Maybe that's a better way to say it. It's highly likely that we will give an acute remedy. So, for example, during COVID, anybody who got COVID, if they truly were expressing symptoms of COVID, it was an acute. We were treating it acutely. We weren't treating it based on their chronic condition. Now, someone's chronic condition might help us to understand their individuated response, like someone who had a weakness in their upper respiratory might be, so much more susceptible to having really, difficult time with COVID, for example, right? So that would have given us maybe some information that we want to make sure that we're getting a remedy that's also covering that level of susceptibility, right? But if somebody has an injury, even when I say about like someone with a neurodegenerative issue not prescribing on a lot of acutes, an example that I often refer to is a case. I've had many cases of people with MS and ALS and those kind of neurodegenerative issues, and they often don't put out true acutes. Yeah. Now, let's say someone had a surgery. Well, we would do our pre- and post-surgical protocols, right? Because it's going to override whatever their chronic condition is. Do you agree with that?
Yeah,
Does
totally.
that sit? Yeah.
Yeah. I think, for me, until really COVID, I would have said that if I'm doing the stats on my practice, I would say that I deal with 10 acutes a year.
Oh my gosh.
And
for real?
Everything else would be chronic. Yep, totally.
Wow.
And most of those would be insect bites.
Right.
And that's just where I was.
Yeah.
But no, I see and totally appreciate the extraordinary work, what you have done with the establishment of HHN, because, I think in my own, it's really, I'm just making a personal statement, really. I think if I was, a mum with a couple of bruisers, bruisers with R, as kids running around getting lots of dings, then, I might not have been the homeopath in that instance.
Yeah.
My practice was always much more chronically oriented, and then the reality was that I dealt with very few acutes.
Oh wow!
In my career.
Yeah. See, and I think part of that was the training I had working at a big clinic.
Yeah, totally.
Right, because we
in Minnesota.
In Minnesota.
Yeah.
And I was the low person on the rungs, and so I would cover people's call more and got to see the acute things that would come up on the weekends when they would send the fax.
Fascinating.
It was. And you learn a lot doing it. And, and the thing is, we've had to make some decisions, excuse me, with HHN, with Homeopathy Help Now, Homeopathy Help Network. And sometimes something comes in and we look at it and we say, it's very likely that this is related to their chronic case. Well, you're pouring tea. Can I have a little more?
Yeah, sure.
Alastair made a perfect pot of tea today. That's good. That's all. And so we've had to make some decisions because we look at something and say, that's actually related to their chronic, very likely related to their chronic case. But let's help them through this and have a conversation about if this comes back, you might want to seek chronic care. And an example for that might be, a kid with recurring ear infections or someone who gets, like cellulitis, for example. We think of cellulitis as being acute. I have a couple clients. I have 3 clients in my practice that have recurring cellulitis as a chronic issue.
Wow.
Yeah. And treating it when it is acute has actually helped to understand the chronic case. And, what you're looking at sometimes when somebody has what we would refer to as an acute exacerbation of their chronic state is looking at the intensity, the frequency, and the duration of these episodes that they have, right? And oftentimes, so let's say that somebody comes into HHN, we don't know their whole chronic case. We ask, questions just about their baseline level of health because we want to make sure that we aren't doing something that is, that is sort of a deeper treatment than perhaps would be appropriate, right? But, one of the things that really kind of came clear to me in studying sort of Hahnemann's developments when he got to the point of chronic diseases, right? So 1816 to 1828, Hahnemann kind of goes and says, I'll be back, and starts looking at everything that he had done up to that point. And he realized that part of the reason that people were relapsing is because he was treating everything as if the same, acute and chronic conditions as if the same. And that's when his idea of the miasms really kind of locked in. And so at that point, he also had a different perspective on remedies, right? And started to look at remedies, saying that some remedies are deep antimiasmatic remedies capable of, unearthing and unraveling the deepest levels of chronic disease, and other remedies are more superficial, right? So one of the things we talked about, I think it was in our last podcast or the one before, we were talking about the students and their small remedy projects.
Yeah.
And I was thinking about this after, because we didn't actually get clear about what makes a small remedy. Because I also think it's important to to ask the question is, do we call something a small remedy because we have a small amount of knowledge around it?
Yes.
Or is a remedy small because it has a small sphere of action, which some remedies do, right? And sometimes it's just that we have an incomplete proving, or we have our information about the remedy based on toxicological or its use in an herbal tradition or in the medical tradition, right?
Keep going. Absolutely.
Right.
All of those are correct.
Exactly. Oh, well, thank you.
Yeah.
Well, thank you very much. But when we talk about a small remedy, sometimes we are better served giving a remedy that is known to have a more superficial action or to focus on one area of the body than a deep acting remedy. So an example would be, you got a person with a GI issue. They've got some explosive diarrhea, something like this, right? And so you're treating them acutely. They come through the helpline, and their case is taken. And maybe this is something that they've had a number of times, and they haven't been diagnosed with maybe an inflammatory or ulcerative bowel condition. But you're thinking, gosh, this has hallmarks of, autoimmunity to it. There's a pattern that I'm seeing, but I'm only dealing with this person on an acute level. And let's say that in the, repertorization and analysis of the case, you see a variety of remedies that cover the constellation of symptoms. And you might see a remedy like lycopodium, and you might see podophyllum. If you've got an acute situation, a person with whom you don't have a relationship related to their chronic case, and you're not really sure what their level of health is, well, choosing a remedy like a podophyllum that's like a smaller remedy with a limited sphere of action seems like a much better clinical choice.
Usually, yeah.
Yeah,
Totally.
exactly. Yeah. And this comes up like when I, like in our final semester when we teach complex case management and, sort of helping people to look at cases and to really, look at 15 permutations of a problem before making a clinical decision. One of the examples that I'll often talk about is somebody who has a GI issue, an ulcerative or inflammatory bowel condition, that those cases, we often will respond acutely if they're having an exacerbation in their case. They're having, a GI crisis, right? Because there are so many remedies that fit a nice small totality that don't disrupt that. Whereas if you've got someone who has a degenerative neurological condition and they're having a GI issue, well, you're not sure the cause of that because it could be a part of their loss of function, the overall loss of function, for which you don't necessarily want to intervene with a deeper remedy. Does that make sense?
Makes perfect
Was that
sense.
too deep a conversation for a podcast?
Well, it wasn't too deep for me, if that's what you mean.
Well, that's a relief.
I know I was starting to stare out the window, but that's because the sun came out.
Yes, it did indeed.
No, I like it actually, and I think it really kind of provides a bit of shape to the conversation around what makes for small remedies and what makes for polycrests.
Yeah.
And it's when you think about it. See, it's that small remedy assignment that we might have spoken about it, but I had
totally
a realization in it, and I think it was the remedy of sarsaparilla. Someone was giving a great description of the remedy sarsaparilla, and I went, who did the proving? And of course, it's a Hahnemannian proving.
Yeah.
So how is it that sarsaparilla did not make it through, and ledum did, or cyclamen did?
No, sarsaparilla made it through. Because...
No. But what I mean is to polycrest status.
Oh, I see.
Yeah. So what Bryonia? Why Bryonia? Because of its extraordinary action, breadth, characteristics, and all the rest of it. But sarsaparilla didn't?
Well, but
same provers?
Yeah, but sarsaparilla, it's got a very focused sphere of action and is useful in venereal conditions.
Yeah.
So it would have made it through because it would have been a remedy that would be useful for the treatment of, and I don't know if it was gonorrhea or syphilis. I'm going to guess, or not gonorrhea, sorry. Well, yeah. I was going to say psychosis or syphilis, but whatever. Anyway,
the point that I'm making is I like the conversation because, and the other way as well, especially modern remedies, they're often, obviously they start small.
Yeah, because it takes a while to really learn the full action of a remedy.
And some remedies become artificially bloated very early, like bamboo, for example. I don't know if you're around in the 90s when bamboo hit the hit the software packages, but it was
or when we got hit with the bamboo stick,
bloated, massively overcooked.
Do you remember
remedy.
when
it used to come up more than sulfur?
Oh yeah, totally. What that means is that what Al's talking about is how remedies can make it into the repertory and into the repertory software, so that in an analysis, it will come up more often than perhaps it's indicated. I was amazed once I did a deep dive in bamboo and realized the affinity for the female hormonal system.
Totally.
But I missed that its first go around. Mm-hmm. Because you hear about it more for structural issues and, ankylosing spondylitis and stuff like this.
No, it's an interesting one.
Yeah.
I think, like how we would really struggle to prescribe these days without scorpion.
Oh gosh, yeah. Gallium.
Two examples of polycrests,
mm-hmm.
both
germanium,
newer remedies, and some remedies they just hit the spot, don't they?
Oh my gosh,
they really do. And I suppose they're well publicized and they're well repertorized. Yeah. And there's easily found information on them early. Then I can see how different remedies get a wriggle on, a roll on. And, start to expand.
And it's funny because it's funny how some remedies really stick and you really sort of need them. And some remedies, like if I just think about like the three remedies that you noted are all Dynamis provings. They're all Jeremy Share provings. And those.
I told you about Chanel No. 5.
Yeah, we talked about that on the podcast.
Okay. Yeah,
I couldn't believe that. I keep forgetting to look it up.
It's extraordinary. It's actually a very, very methodologically sound proving.
I love that. I'm glad that you mentioned it because I keep forgetting to do a deep dive. But it's funny how, so let's say Dynamis provings, like if you're looking at the arc of Jeremy's provings, well, Androctonus was the first one, right? So you would think, oh, well, start off slow and then you build and you get better at it. But it's just that remedy, it's a substance that sticks.
That's it. And see, whereas Brassica, no. Whereas...
Right. I prescribed that one time.
Yeah, exactly. Whereas...
And the gems.
Titanium, no.
Well, did he do the titanium proving?
Krypton.
Krypton, yeah. But wait, titanium, because but it's, dang. I think that's my favorite proving of all the provings.
Krypton?
Yeah.
Well, that's because...
Because you probably think I need it.
You're just a little crazy like that.
I'm crazy like a Krypton. But no, some of the titanium, because when I teach row 4, because when I teach titanium, I'm 99% sure that, it's Kent has it in rubrics for lupus, and
Kent. Really? Mm-hmm. Didn't know that.
And I feel like I'm pretty sure about this, and I say to the students, because when I teach row 4, I teach it for how do you find the things you don't know you're looking for? And a lot of times in homeopathy, you are finding remedies by analogy. You find other things and you go, it's not this, but you know that game, I'm getting warmer, right?
It's lactafluoratum.
Lactafluoratum, I mean, that's a remedy I always say when I teach it. People are overlooking it, right? Kent's got tons of cases of diabetes in lactafluoratum. And also, so it's so good for migraine headaches, it looks like iris versicolor. And so you see these cases where people have been giving iris with good but not lasting results. Lactafluoratum. Oh my gosh.
Boomfa.
Let's go back though.
What do you mean back?
Because we started talking about us. But what I wanted to follow through on is that, so we were talking about how this idea of waiting until there are good symptoms, and we were sort of torturing each other because every time you would complain to me, no, I don't feel good or whatever, I'm like, well, then you have to give me good symptoms or, I can't give you a good remedy.
That's not how it happened because you threaten. You say, I'm
you don't
not
need to say this on a polycrest on a podcast.
Well, but I mean, we've got to speak the truth.
Okay.
You say, I'm not going to treat you until you give me a decent symptom.
It's not a threat.
That's
a reality.
That's a threat.
How do you, what am I supposed to do?
So I just make stuff up.
Yeah, like there's bricks in the wall. I'm building a wall with bricks. That's what you kept saying. I'm like, what am I going to do with this? Ridiculousness. But then once you get a symptom.
I had some febrile dreams, didn't I?
Oh, my goodness. But here's the thing. So when there's something acute, and this is tough, right? Because you think to yourself, if only I could find a better remedy, this person would get better more quickly. Sometimes you can't find a better remedy because you don't have the information. And sometimes the person can't give you the information because it's not quite ripe yet. And you sort of have to go through a little bit to get to that place. And that's why I feel like even though we wound up being sick for a couple of days, we would come to the point where we would have clear symptoms, we would get a remedy, and then the intensity of the symptoms would pass. But the point that I wanted to make, what made me think I wanted to do this topic for the podcast, was to talk about energy and matter. Because one of the things about getting sick is that it does take time for recovery. And that even though, like I would say I was sick for 2 days, like couldn't watch, a movie or read something, like really uncomfortable, just, febrile and all that.
Yeah.
But then when I started to move out of it, even though I didn't have an appetite and I couldn't really work or anything, I did feel, I felt okay in myself. That's the difference. Anyway, so this idea good. The idea of recovery.
Yes.
In other words, I think we forget in our modern convalescence.
Yeah.
That it takes some time. Sometimes when you get really sick, your body is like burning through a lot of the cobwebs of life, and then you rest. And, in a lot of cases, that loss of appetite becomes a fast. And we wound up fasting for more than a week.
God, it's been 2 weeks, really, hasn't it?
It'll be 2 weeks, yeah. It'll be 2 weeks.
Can I have some food, please?
Yeah. No, I'm sorry.
Please feed me.
No food. But so that idea of recovery, and I think, for people who might be listening, and it always cracks me up that people actually listen, so thank you. But that when our clients are pushing us because, there's nothing that sets me off more than, you're working really hard on somebody's case and they're frustrated because they have a responsibility and they're like, I need you to do this. I need you to get me out of this. I need you to fix me, basically. And it's like, your body needs to get better. And sometimes that takes time and it takes really good food and nourishment or fasting and resting in order to be able to come back from being sick.
Yeah.
But we've lost that.
We have.
I mean, I think about it because, we got sick over spring break, and I say, in a way, thank goodness, because there was no teaching. But even, with all the things that had to get canceled, it was a lot. Right?
Yep.
Yeah. So, if you just sit there and look at me.
What do you mean?
You're just sitting there staring, but it's a podcast. It's about talking.
No, I know that. Well,
Okay.
I was processing.
What are you processing?
Stuff. Matter.
Oh, right, yeah.
And energy.
And matter and energy, yeah.
No, I hear what you're saying. I agree. I think sometimes what we've just said is less compelling to a young homeopathic audience because of the promise of homeopathy, and they see spectacular results, lots of rallying and energy refound and all of those things, that are so dramatic about great chronic cases. And then, but what we're saying is that, our experience just in the last week has been, need to rest, need to sleep.
Every remedy I felt, it was amazing how symptoms would resolve with every remedy, but the need to convalesce didn't change.
And the hacking?
Oy.
Were you a smoker? A significant for many years?
No, I wasn't a significant smoker.
No.
But I had my
moment.
A nudge. I gave it a nudge,
right.
But I never smoked a lot. And then one day I woke up and it was like, nope, never doing that again.
Yeah. No, I just asked because that coffee it's pretty chunky.
Always has been. That's my phosphorescent side.
Right.
Yeah. All right. I think I'm done.
What do you mean you're done?
I'm done with this podcast.
Huh.
I have things to do.
Sounds like we're done, folks. So all of those burning questions of yours. No, we're done. Hey, there we are. That's some insights, perhaps, into sickness and recovery, convalescence, and getting back on the horse.
Yeah.
Yeah, love it.
Next time we'll have more energy
Totally.
More cat meowing.
And guess what?
What?
We'll have had the Jack.
Oh, JHC conference starts in a week.
We'll be back. So look, this one will land. This podcast, bam, will land.
Bam. Number 50-something.
50-something. And then not next week because we'll be somewhat busy.
Maybe I think we should try to get one in anyway.
Okay.
All right.
All right.
That's it. Thanks, folks.
Take it easy.
Introducing Homeopathy, the film, will be screening this year at the Joint American Homeopathy Conference. To purchase tickets, you can go to introducinghomeopathy.com/JAHC exclusive. Please choose Home Foundation as your ambassador after purchase. See you there! Enrollment for fall semester at AHE is underway. There have been lots of recent changes in our offerings. Professional programs now start at $16,000. Early enrollment discounts are available until May 15th. Get your application in and chat with the admissions team. Your journey starts now.